And as for children, 18 are currently being treated at Helen DeVos Children's Hospital. That's the highest they have seen, but it's still considered relatively low. However, doctors believe kids are the driving force behind the current surge. 13 on your side's Charlie Tinker joins us now with that part of the big story coverage.
Yeah, good evening, Val. Meanwhile, we've seen reports largely coming out of the other side of the state of districts going back to virtual. Several, for instance, opting to go remote one day a week more to ease some of that strain. But many of the major districts in West Michigan did tell me, they're putting every effort into avoiding that unless it's absolutely necessary, partly due to decreased flexibility from the education department in terms of how those days are actually classified. Then you have this statewide coalition of thousands of parents, which calls itself MyPass, really upping the ante on the demand we've heard for months, which is that MDHHS issue a universal school mask mandate. At one point petitioning the state government this fall to turn that into policy. Father of two, Alex belongs to a West Michigan org pushing for that data-based approach in the classroom, Smart Science Alliance. While he supports that idea of mom and dad having a say, it's the science that will shine a light on that path, which is why he wants a masking mandate to go statewide.
This is not just about public health. This is about so much more, and that's unfortunate. We've become so distracted. We've really lost sight of the importance of taking those steps so that we can protect each other.
I reached out to the state health department for comment on that mandate push. They passed along this statement. Quote, the state is committed to ensuring Michigan students and educators are as safe as possible in the classroom. We have issued school guidance that strongly recommends a universal mask mandate in schools. Shying away from touching directly on that idea of a statewide K through 12 mandate they themselves would issue, but again deferring to individual districts. We've got a number recommending it, fewer. Grand Rapids or Holland, for instance, with the actual requirement there. Which brings us to the jab. Where do we stand there a few weeks into approval of the pediatric vaccine? Cherry Health, for one, a day into a vaccine clinic partnership with GRPS. About as expected there, 10% or so of those eligible have registered so far.
There'll be a little bit of a delay before we get to an acceptable threshold for pediatrics. Parents are always a little bit more cautious. Studies are showing us that kids are actually having less side effects than the adults. So hopefully as people start to see that, they'll become more comfortable and get the kids protected.
We've also got MDHHS just starting to feed data into the vaccine coverage dashboard on its website. According to that data, around 5% of the more than 800,000 eligible kids in Michigan have received at least one dose. That's the gray there for initiation. Although based on what I've seen locally, there may have been a bit of a lag there on the state's website. So of course, that bears watching.